Hello, I'm Zero CEO Jamie Burse, and welcome to the most impactful week in the movement to end prostate cancer. You now have exclusive access to informative and dynamic sessions, interactive presentations, and lots of downloadable educational materials. Plus, you can connect and chat with participants and presenters from wherever you are. Please join me right now for the virtual Zero Prostate Cancer Summit.
Hi, folks. Welcome to the Veterans and Prostate Cancer Know Your Risk. I'm Ali Manson with Zero, and I'm joined by Zero champions and U.S. military veterans, Mike Crosby and Tony Minter. We're here to talk to you today about veterans and their risk for prostate cancer. But first, I'd like to offer a sincere thank you to our sponsors, Merck and Viatris. I'll start with the facts. 1 in 5 U.S. veterans will develop prostate cancer in their lifetime. For comparison, prostate cancer affects 1 in 8 men in the general population. That makes prostate cancer the most common cancer diagnosis among U.S. veterans. There are nearly 489,000 prostate cancer patients in the VA health system, and 16,000 of those have metastatic prostate cancer. And of course, that doesn't include veterans receiving their care outside of the Veterans Health Administration. The Veterans Health Administration, or the VHA, offers the very best that the medical community has to offer for prostate cancer patients, but it isn't available to every veteran everywhere. At Zero, we're working to ensure equal access to the best care available for all veterans with prostate cancer. And because we know the best thing we can do to reduce the number of veterans with metastatic prostate cancer is to diagnose them earlier, we're also working to ensure that veterans receive better education about their risk and access to early screening and diagnosis. The numbers I mentioned are compelling, but for me, the best way to understand what risk looks like is to hear someone's story. So Mike, why don't you tell us a little bit about your military history and your prostate cancer journey?
Sure, thanks, Ali. Nice to be with Tony and you and all of Zero. And first of all, thank you for giving us the opportunity to chat with you about this and with all the veterans and men out there. My story really begins 1983, graduate of the U.S. Naval Academy, pursued the aviation pipeline and flew F-14s for about 15 years. I went to the reserves and ended up as CO of a Mobile Operation Command Center, and then was reactivated in 1991 as a result of, 2001, as a result of the 9/11 attacks. And then ended my reserve career with U.S. Central Command as the Deputy Chief of Counterproliferation. So then, since then, I was in Phoenix, and I was doing an annual PSA and annual physicals from my flight time. Or being an aviator, you need to have an annual physical. And I, in 2014, was working actually in Asia, but doing my physicals at the Phoenix VA. I had always maintained my accounts or my medical records with the VAs. And if you remember back in the press in 2014 and 15, there was a lot of negative press about what was going on in Phoenix. So I was a part of that scheduling issue and whatever. But I got my results in 14. I didn't pay attention, actually. I left the day after my tests and was told on the phone that everything was okay. And this goes to my fault about knowing what a PSA is. And I learned really quick what a PSA was and what the numbers mean. And I came back the next year, and the doctors had looked at my tests and said, well, and I had to request this PSA because at the time, the Preventative Services Task Force guidelines were recommending that government agencies and anybody in medicine not check for PSA, that it was the checks were causing more harm than what the actual disease would cause, which was sort of backwards to me. But anyway, I'd always asked for it. 2015, my PSA came in at 14.7. So everybody knows what the response is. Before that, it had always been at about 2.5. The year before, as we look back in history, it was at about a 5.7, and I needed probably to have a biopsy the year before because, as it turns out, I did have cancer. The VA at the time in Phoenix said, whatever, you probably got cancer, come back in 6 months and we'll deal with it then when we can sort out the scheduling issues. That wasn't really the right answer. I was lucky enough to know that wasn't the right answer because of a family member who had prostate cancer as well. So I stepped out. I made some immediate calls, immediately got a biopsy, actually same day as the call. And turns out I had Gleason 7, 4+3 was the initial diagnosis. Upon subsequent evaluation, then I went for treatment. Upon subsequent evaluation of the tissue in that that was taken, I ended up with a Gleason score of 8. So I was right on the borderline of that 4+3 and 8. So it had already spread, but we didn't know it. I initially had a treatment of CyberKnife in 2015. I was finished on New Year's Eve of 2015, and life was okay. I went to the Zero Summit. I found that in 2016 was my relationship with Zero started at that summit, and honestly found out that there was a lot of information out there, and that the difference in the information is that it was accurate. And that was a big issue, is that they're putting out real information, verified information, doctors doing research, which was sort of new to me. We didn't realize that because nobody really thinks about your prostate anymore. And that's one of our missions, is to raise that awareness. So went through the whole the Zero Summit, was very, very impressed, pushed on Arizona as an advocate with my friends there that are still good friends today. I then went on living life, doing my quarterly checkups. And then in 2018, we had subsequently moved to Oklahoma City for work. And my PSA had started to go up again. So at that time, they gave me this new thing called Exhuman imaging, along with all the other scans. And that was actually done outside the VA because the VA was taking at the time about 6 months to get an appointment with the urologist. So they sent me across the street to Cancer Institute, Stevenson Cancer Institute, who took very good care of me. But that was it was all referral issues, local referrals, and that sort of thing. And I mentioned that because things have changed and they're continuing to change. The VA chief of staff denied my referral out of the VA. I ended up raising a lot of issues around that time, and I subsequently ended up moving to the West Coast after giving some speeches in LA and meeting some of the premier doctors in the precision oncology program and in the VA, who encouraged me to move to the West Coast. And I did it, registered with the West LA VA and San Diego. I then entered a clinical trial for the PSMA gallium-68 at UCLA and the West LA VA, which then confirmed lymph node involvement through a new PSMA. In August of 19, I went through my second CyberKnife because it was in a position where the urologist couldn't deal with it. The PSA, which everybody uses as this guideline, and I'm an advocate for research into to newer screening techniques and new discovery techniques or diagnosis techniques. PSA dropped as it was expected to. Everybody thought it was cured. And again, in 2020, during COVID, and during my quarterly checks, PSA started to rise again. So by this time, I'm up in West LA last year, working with some of the best doctors on the planet. They aggressively gave me another PSMA of F18 PYL and did all the other scans, the MRIs that they referred me into. They found more cancer and even residual cancer back in my prostate, which was undetectable on any of the other scans or anything else. They did an MRI fusion biopsy, which is highly recommended because they confirmed prostate cancer had come back in my prostate, or it was just never treated, which everybody thought it was treated, on a really, really small piece. And the only way that really it could have been found was doing that PSMA and the MRI guided biopsy. That was Gleason 8. And then they immediately commenced ADT and androgen deprivation therapy and ARI combined with Xtandi. It's a 6-month version, and that started in July. The they had found out that the pieces of my prostate were too small to do anything with. But we found a new technology actually that is a sponsor of Zero. So I did the laser ablation in September. That was followed by 35 rounds of radiation to take care of my prostate bed and and the prostate bed and the other lymph nodes that had been affected. That was all paid for by the Mission Act through the San Diego VA. And I didn't, if you didn't know about that, and that's another issue of raising awareness, so we're happy to talk about. And then the next piece was January of this year, just a few weeks ago, was my last round of Xtandi, and the Lupron is just wearing itself out. So I'm on a treatment holiday right now, and I've never felt better.
Thank you so much, Mike. I know I have some questions for you, but first, Tony, your story is a little bit different, so I'd love to hear it.
Sure. Thanks for having me, and glad to be here with Mike. We met at a Zero Summit, and we connected as veterans. My story is a little bit different. I retired from the military as a flight paramedic, and from the time I retired, I was getting the PSA every year at the VA. And I noticed that my PSA numbers were starting to go up. My doctor never really discussed it in our sessions. It was just part of the test, and she would say, your tests look good. Now, this is my primary care. Your tests look good. But I noticed that my PSA numbers were growing, starting to rise. So when it started jumping whole numbers, like from 1 to 3, and from 3 to 5, I told my primary care that I wanted to see a urologist. And she acquiesced and let me see a urologist, and I went in and sat down with her. She says, okay, so, I'm looking back at your old PSAs and have a little concern, but not much. I said, well, right now my PSA is 5.6. And I said it got from 1.2 to 5.6 in less than 2 years. So I want a biopsy. She says, well, I'll see if we can schedule you for one. So she worked it, scheduled me, and got me a biopsy. And came back, and she says, well, I got good news and bad news. She said, the good news is, the bad news is you have cancer. You have prostate cancer. The good news is, I think we may have gotten it early. And I said, well, that's great news. And she looked at me like I was crazy. And I said, well, I've been kind of an advocate before now. This will just give me a better way to help men. So she says, well, what do you want to do? I'm a surgeon. I can just go ahead and cut it out. I said, well, why don't you tell me about what these numbers mean? My Gleason score, and the 3s and the 4s and the 4s and the 3s and what all of that stuff means. So I had to prompt her into explaining to me what I already knew. But I needed her to explain it to me because I looked at it from the perspective of what if another veteran was sitting here and didn't know to ask those questions. So she explained everything to me. I was a Gleason 7. Immediately I started thinking about all of the other risk factors that I had. And so for me, the Gleason 7 was significant. And so she says, take about 90 days, go and do some research and come back and let me know what you want to do. So I said, okay. And I left there and I was thinking, I'm in the medical field. I understand what doing some research is and I can kind of figure things out, but I don't know if a whole lot of veterans got medical backgrounds where that kind of solution would work for them. So anyway, I went and I did the research and I decided that I wanted to do radiation. In fact, I wanted to do brachytherapy with the seeds, and I also wanted to do external beam radiation. The only thing that they were doing at the VA that I was going to in Columbia, South Carolina at that time was just radical prostatectomy, just removing it. And so since I wanted radiation, I had to begin to work with the VA to find a place to do it. And they referred all of their radiation therapy out to a local center here in the city. But for what I wanted, which was the brachytherapy and the external beam radiation, I had to go to Atlanta to get that done. And so they worked with me, and I will give them that. They worked with me to get to Atlanta, and I spent 2 months down in Atlanta getting my seeds and getting my external beam radiation. And at the conclusion of my treatment, I felt pretty good. A couple years into it, I started to feel some of the side effects of the treatment. And this is where VA really got crazy for me. I started having problems with urinary retention. And so each step of the way, they would go in and they would open me up, and it created scar tissue, and it would close back up. And it went back and forth to a point where it stayed closed. And then the doctor told me, well, we can't open it up. So they sent me to another doctor to get a suprapubic catheter in. Okay. I kept the suprapubic catheter in, and it was the most awful thing I had ever experienced for about 3 or 4 years. The pain was unbearable. And so I was doing some research trying to find, okay, what is it that I can do? So the VA said, well, I started off at MUSC in Charleston, South Carolina. So the next step was to send me to a private doctor in Atlanta, Georgia. Went to Atlanta, Georgia, they said the same thing. Wasn't a whole lot that they can do other than the suprapubic catheter. So I went to a summit, and I was talking to one of the physicians at the summit, and she said, what you need is a reconstructive urologist. And I'm going to refer you to a couple. And so she referred me to one in Chicago, and VA wouldn't cover it because they were out of network. So I did some research, and I discovered there was one at Duke University Hospital. And I went back to my doctor, and I told VA, you know, this is what I want to do. And we went back and forth. And the longer it took, the worse my condition was getting. So what he was able to do a year and a half ago, he now couldn't do that. I ended up having to have my bladder removed completely, and did a resection with my intestines. So now I have a urostomy bag on now. Now compared to that that tube that I had before, this is a godsend. It enables me to do anything and everything I want to do. It's just a new normal. But the battle and the fight to get VA to cover the treatment that I knew I needed and that they knew I needed, it was difficult because they kept on sending me to these different lower echelons of care to get to what I really needed. And it was a waste of time, and it caused me to have more done than I needed to have done. Now, my gratefulness is for Zero and the summit, the ability to talk to physicians there and to understand what's going on, to get information, and to really hone in on what I needed as a patient and what I can get from the VA. Like Mike said, you really have to manage your own care and take care of it, because if you don't, they're not, you know. And not knowing the questions to ask your doctor, I just saw it as an opportunity to step in and represent as many men as I could who were veterans in navigating the VA system. It's a challenge, but it's worth it, to make sure that they know what their rights are and what they can and can't do, and to help them to navigate things and talk with their family and you know, shore up their support system. Zero for me, as a veteran, was a godsend, because through that, I was able to get the treatment that I needed. Took a while longer than I expected, but I got the treatment that I needed, and my quality of life has improved so much. I got a new normal, but it's better than it was. And I just hate the fact that I had to go through 4 years of intense pain with the VA to finally get what I needed. And that was a problem for me.
Jeez. Well, thank you, Tony. I mean, thank you for your service, and thank you for sharing your story. I mean, that's a whopper. And the two of y'all have pretty different stories, but I think what you have in common is you're both tremendous advocates for your own care. And I think that most of us know that is something you have to do in order to get the right medical care a lot of the time. But um, I think what it tells us, of course, is what a challenge it is for most people to do. I mean, I think it's harder. We underestimate the importance of speaking up for ourselves. And, when we think about the systems that people are working in, I think we also underestimate how difficult it is to speak up and say, doctor who has all this, very specific training, but this is what I've learned about, and this is what I think. So really, I think the two of you are great examples of that. And I'd love to ask a couple of questions. I think we have time. My first one is a veteran who is just diagnosed with prostate cancer. What's the first thing you would tell them to do? And Tony, I'll look to you first.
Sure. The first thing I would tell them to do is pause. It's not necessarily a death sentence as most people think. When you hear cancer, you're kind of in a fog. And I would suggest that when they go to get their diagnosis, that they take somebody with them during that time. But really pause and take in all of the information. Ask questions about what those numbers mean. The Gleason score, your PSA, your risk factors. Just find out as much information as you can. And really look at your biopsy results to see exactly how many cores they found. Just educate yourself about what it is that you're about to be treated for. With prostate cancer, there are so many different treatment methods, and you have to be responsible for your choice. And the only way that you're going to be comfortable with your choice is by researching, asking questions, joining a support group. Even before you decide what your treatment method is, find out about a support group, join it, and ask those questions in a comfortable, safe space, because the journey just begins with the diagnosis. That's only the beginning. But just pause. Take your time.
Thank you. Mike, do you want to add anything?
Yeah, I mean, I'll put in a plug here because I think that a lot of people initially go home and quickly run. I agree with everything Tony said. Bring somebody to the appointment with you when you're getting the debrief of your biopsy, because they tell you right there on the spot that you've got cancer, and they're just sort of the doctors. Criticism I have for urologists is they do it every day, so they're sort of numb to the whole thing. I try to promote with the physicians that, hey, wait a minute. Every time you tell somebody the first time they've got cancer, you've just now introduced a traumatic event in that guy's life. Mm-hmm. And, we as veterans understand that even more so, I think, than a lot of the people in the general population. And we're spending billions of dollars on post-traumatic stress disorders and that sort of thing. And this is no different. You've just now changed a man's course of his life. And not just his, but also his families and his caregivers. And I try to encourage guys to, as Tony said, and I'll reiterate, is to stop. If you need to talk to somebody in the professional setting, call a therapist. There's no reason why you shouldn't. Most men don't think about your prostate. I know Tony probably didn't. We've talked about this. You don't think about your prostate unless you're in the medical field like he was. I was lucky enough to have, unfortunately, one of my children's father-in-law was diagnosed, so he was dealing with the prostate cancer, so I understood it a little bit. But there's no reason the guys actually promote prostate cancer screening. We're men. We just don't deal with medical stuff, and that's got to change. That's part of the awareness thing. The other is, don't go home and just Google prostate cancer. Don't do that. I mean, that's not helpful. What I try to promote is go to Zero's website and go to the resources and start reading from a no kidding, proven, authorized, really very well researched set of data, because you can get lost because you don't quite understand on the first diagnosis what stage you're at. You don't understand what the options are. If you're stage 2, you don't need to be reading about the stage 4 type of things, right? And then the other is sit down quietly and talk to your wife or your loved one, right? I mean, and sit down and discuss it. and develop a plan. This is something that's new. You've never had this in your relationship. And as Tony said, you've got to talk to people. You've got to get guys involved. You got to start building your team. And that's your care team and your family support team. And really the one that's, that's closest to you is going to be your caregiver. And she didn't typically ask for this, right? She didn't want this to happen either. So realize as a man that this is as much a surprise to her as it is to you. Okay, so it's going to affect your relationship, and you need to open your mouth and you need to talk about it. The other is get a second opinion. I try to promote it is that go get a second opinion, because if you went to a urologist, unfortunately they're triggered to let's operate, just like Tony's was. Go talk to a radiation oncologist. Right? Get out of the box of surgery and go talk to somebody else and look at those different options and see what's out there. The other is if you're in the VA, now if you're diagnosed, you're eligible right now today for a DNA sequencing, free of charge. You're supposed to be given that right away. And why you're doing that is it provides the doctors and the oncologists with a lot of options based on any of the mutations that might come back. And it gives them a better insight into the personalized care that you might need. And this care is changing every year. I mean, this industry, the one thing you'll learn by going to a Zero conference is all of the new technologies that are coming out. I mean, the new drugs are finishing up trials. There's last year I heard there were over 600 new treatment drugs in the pipeline right now just for prostate cancer. Now, maybe 10 of them will come out, but there's 600 drugs out there that are being researched. So come to the Zero conference, sign up as a champion, learn what's going on. It's a great resource, and it really is the largest and probably most extensive patient advocacy source out there. So I know Tony echoes the words is that you got to sign up, whether you're a vet or you're not a vet. Go to the source and figure out what your options are.
Thanks, Mike. And I want to get in one last question before we have to break. I know both of you got some of your care outside of the VA system. Now it is possible for veterans to receive care because of the Mission Act through the community care networks outside of the VA system. But can you both talk a little bit about the challenges and how to address those challenges for getting care that you need that you may not be able to get within the VA? And Tony, I'll go to you first again.
Okay. Well, for me, one of the problems was there were certain time limits that were in place at the time. Like there was a 30-day window that I had to get everything approved. And once it fell outside of that 30-day window, then I had to reapply. And so there was a lot of reapplying to get outside of the VA to get them to pay for it, to pay for my treatment, to pay for my medication, to pay for my travel. And then in the process of that, I learned that there was another program that I could, possibly qualify for. So they were not telling me what these programs were. I had to do the research for myself to find out what they were and that they were available. And the other thing is there's certain, and this is again at the time that I was seeking outside care, because I was over 50%, I was eligible for some of these programs. But if you have a veteran that let's say 20% or 30%, they were not qualified for some of these programs. So I think with the Mission Act, that hopefully that's not a issue anymore. But they have especially in the VA here in Columbia, they have an office that talks about all of the care that you can get outside of the VA. They have people who are qualified to walk you through it, to talk with you, and let you know what you need to do to get the care that you need outside of the VA.
That's great. Mike, you want to add on to that?
Yeah, and what Tony referred to is, and you're exactly right. You really got to ask, and a lot of the VAs, not all of them, and that's one of the issues that we're trying to raise through our efforts, but is sort of standard access or standard of care, and the get rid of the disparities across the VA system. I mean, there's 176 hospitals in the VA. I mean, it's the largest integrated healthcare system on the planet, not just the U.S. And so they've got their own set of problems, but I will applaud them. They are actually trying, and they are actually getting better. 2018 Mission Act was passed, And people need to realize that that bill that passed and appropriated, there were $100 billion allocated and appropriated for that program. That's for care for veterans outside the VA. How you exercise that and how you access that is another challenge, right? That's something that you've got to pay attention to, and it's not hard. You've got to ask about it, first of all, and you've got to know how to navigate it. Fortunately, I've been intimate with that program because that's what's paid for all of my care recently. But it's finding the right, providers that have signed up. They all have to contract with either, there's two companies they have to contract with. There is money available. There's a process to do it. And if you need help navigating that, we've got resources and we're available to help with all that sort of thing. So a lot of it is not expecting everybody to know the entire pathway and journey. We're happy to help with that. And that's part of that, building the network and building your team of care to help you through this journey.
Mike, and thank you to both of you. I have, I think, a lot more questions, and I'm sure the folks listening at home do too. But what I'm going to suggest is that through the Summit app, in the attendees section and in the speaker section, you should be able to find Mike and Tony and send them messages actually through the Summit app. So I encourage folks to do that. If you want to learn more about veterans, find resources related to getting care through the Community Care Network, visit www.zerocancer.org/veterans. And if you're a veteran with prostate cancer who's interested in getting involved with Zero, helping to educate other vets or take action on advocacy opportunities, please feel free to email me personally. It's ali@zerocancer.org. That's ALI@zerocancer.org. And thank you all very much. Have a good night.
Thank you. Goodbye.
The issues you care about most are right here at the virtual Zero Prostate Cancer Summit. Please check out the other topics, sessions, and virtual get-togethers in your Summit app. Remember, you are not alone. Join the Zero community to gain support and more information on prostate cancer at zerocancer.org.